County Government Benefits and Insurance Committee will come to order. Susan, if you'll call the roll, please, ma'am.
Dr. Andrea Anthony. Here. Commissioner Carl Boyd.
Here.
Amber Brown. Here. Shay Crowell. Here. Holly Deering. Here. Brian Gaither. Here. Mary Hickerson. Here. Lois Miller. Commissioner Alan McAdoo. Here. Commissioner Jeff Phillips. Here. Brian Runyon. Shantae Sherrill. Here. Steve Spence. Here. Eric Tutobeni.
Thank you. Ms. Hickerson, have you had an opportunity to read the minutes?
Yes, sir.
Thank you. Do we have a motion? We have a motion. Do we have a second? We have a motion and a second. All those approving the minutes say aye. All those opposed, the minutes are approved. Mr. Elam, you want to address the committee with regard to financials, please, sir? Item 3 on our agenda.
Yes, sir. So the Fund 264 account, and I will read for the month of December. We had 2022, $9,571,129 in revenue, $6,741,025 in expenses. For the calendar year totals, you have $88,236,720 in revenue. Expenditures, you have $81,186,802. And the difference is a positive $7,049,919. For the fiscal year comparison, 2022-2023, you have in the totals $38,284,840. For revenue, you have $41,038,188, for a difference a negative $2,753,348. On the OJI Fund 266, workers' comp for the month of December, $2,308.98. OJI, $60,786.21. The total for December, $63,167.19. The year-to-date workers' comp, $1,357,677.81. OJI, $263,622.26. The total for the 22-23 fiscal year, $1,621,300.07. That concludes my report, Mr. Chairman.
Thank you. Any questions for the director with regard to the 264 and 266 report? Seeing none, I'll entertain a motion and a second to accept.
Motion. Second.
Motion second. All those in favor say aye. Aye. We need a roll call. Thank you.
Dr. Andrea Anthony. Yes. Commissioner Carl Boyd. Yes. Amber Brown. Yes. Shay Crowell. Yes. Holly Deering. Yes. Brian Gaither. Yes. Mary Hickerson. Yes. Commissioner Alan McAdoo. Yes. Commissioner Jeff Phillips. Yes. Shantae Sherrill. Yes. Steve Spence. Yes. Eric Tutobeni. Yes.
Thank you, Susan, for that correction. And I think you're going to give us the OSHA report. Oh, by the way, the motion passes.
The OSHA report for December of 2022, there was a total of 14 incidences, which brings our year-to-date total to 181. Of that, the total OSHA recordable was 141, with 70 restricted day claims, 33 lost day claims, and 38 other recordables. On the next page, that compares our current year-to-date with the year-to-date total for 2021, which was 174, and 2020 at 159. The incurred dollars for 2022 was $655,000 compared to 2021 at $523,000 and 2020 at $815,000. The breakdown of the December 2022 incidences, there was 7 at Board of Ed and 7 at County General. Of the ones at County General, there was 3 at the Sheriff's Department, 1 at EMS, 1 at PAWS, and 2 at Fire and Rescue. And that concludes my report.
Thank you. Any questions for Ms. Thompson on the report? Yes, Ms. Secretary, you're recognized.
Thank you. It's actually just a general overall, just, are you still getting good reports from the departments and everything on these accidents, and everybody is up to date on how to report and things like that? Because I know over time it's gotten better and better, and we hadn't heard lately if you've had troubles of getting folks making sure they're getting all their paperwork into you and everything. So I just wanted to see that, because I know we have trainings that come out that the employees have to do on computers or whatever, and make sure that you're getting the information in a timely manner, and everybody's starting to really get on board on reporting, whether it's medical needed or not.
Yes, and since all the updated forms are on our website now, we can direct them to there, and they can access the most current forms there, and that's helped a lot.
Any additional questions? Seeing none, we'll entertain a motion and a second to accept the report. Thank you. A second, please. Thank you. We have a motion and a second. We don't need a roll call on this, do we? Correct. All those in favor say aye. All opposed, the ayes have it. The motion passes. Ms. Lovett, if you'll come forward and give us the wellness update, please. I was looking for you. There you are. You're over there in the corner.
Hello. Today for our wellness report, so far as of January, we have 133 people that have met all of their wellness incentive points. And for our current and upcoming activities, we are really trying to promote our podcast challenge trivia to get people to listen to the podcast that we started at the end of last year. So we have a trivia going on with that every month with raffle prizes. We have our first quarter wellness challenge, Resolution Revolution. That is going on all the way till February 10th. And then we will be starting up in our upcoming activities. We have a heart awareness campaign that will be going out to all of the departments, so we will be contacting each department to set up a time to come out there and promote biometrics and heart health. And along with our health awareness this month, we are in our podcast discussing the ergonomics of departments, and we will be doing a lunch and learn based off that with a certified ergonomics specialist. And that concludes my report.
Thank you. Any questions? Seeing none, we'll entertain a motion and a second to accept. That's what I was just asking you. Thank you. Thank you very much. Did that on purpose. Ms. Amber O'Neill on the MedPoint Report, please. Thank you. Afternoon.
Good afternoon. So in the month of December, we saw 608 total visits. Board of Ed had 409 of those visits. County General had 175, and retirees were 24 of those visits. We had 490 unique members seen. On page 4, on our visit summary by member type, we saw 88 children, 436 employees, and 84 spouses. On page 5, on our visit appointment type, 91 members had more than one visit in the month of December. 1 member had 5 visits, 4 members had 4 visits, and 86 members had 2 to 3 visits. We saw 441 established patient visits, which is, again, those visits that could be for anything from medication refill to sick care. We saw 48 behavioral health visits, so super excited to see that and see those numbers going up and that behavioral health being utilized. We had 42 nurse visits, 26 telehealth virtual visits that included the video component, 25 annual visits, 11 new patient visits, 11 dietitian visits, and 4 telehealth phone visits. On our visit summary by day, just some information that you need to keep in mind with these numbers. So December 19th was the last day for Stewart's Creek, and December 23rd was the last day for Walter Hill. There were 22 full and 2 half available scheduling days in December. All clinics were closed December 23rd on a half day through December 26th for Christmas, and December 30th on a half day through January 2nd for New Year's. There were 5 Thursdays in 5 Thursdays in December, and Tuesday was the busiest month of December. On our virtual appointments on page 7, we did 30 virtual appointments in the month of December, and Walter Hill again had the highest average virtual visit utilization with 10%. Stewart's Creek had 3.53%, and New Salem had 3.56% of their visits done virtually. Ongoing with our in-person virtual versus virtual visits, you'll see that we are hovering right around between 5 and 6% most months virtual visit utilization. On page 9 for our referral summaries, so we had 58 referrals in the month of December. New Salem had 35, Stewart's Creek 13, and Walter Hill had 10. Those referrals, 8 of them went to neurology, 7 behavioral health, which is our in-house behavioral health, 6 gastroenterology, 4 physical therapy, 3 each for sleep medicine, psychiatry, and cardiology, 2 each for rheumatology, pulmonary disease, orthopedic surgery, and the dietitian. On page 11 for our financials, I just want to give a little bit of note on this because our PEPM for the month of December was $18. That is not a good indicator because of the situation. So know that both Walter Hill and Stewart's Creek closed before the end of the month. So you've got some reduction in cost for our staff costs. Staff cost is one of the highest costs that we have with the clinics. So that gave you kind of an early discount with December with that. Additionally, I stopped ordering supplies and medications unless they were absolutely necessary for all 3 of the clinics because I knew that we would be combining the supplies that we had at Walter Hill and Stewart's Creek into New Salem. So that reduced those costs as well for medications, supplies, vaccines, all of those kind of things, which is another one of your larger costs, especially the medication costs. So this number's a little bit off due to those special circumstances. But that being said, there were 490 total unique members in the month of December. The total operating cost was $115,218.25. We did use an employee count of 6,306, which you'll notice is the same as the month of November. The reason that we did that is because we pull that information in January, and of course the numbers had changed so vastly in January that they really didn't apply to the December totals. And then that led to a PEPM of $18. On page 13, for our diagnosis codes, sinusitis, pharyngitis, and encounter for general medical exam were the top diagnoses for the month of December. Sinusitis, pharyngitis was at just over 12%. A lot of sick care in the month of December. We're seeing a lot of sick people through November and December, really. Still just kind of that flu, cold, COVID, all that kind of season that we're in right now. On page 14 for our visit demographic summary, you'll see that in December, 68.29% of the members seen were female. The female age range of 50 to 59 and the male age range of 40 to 49 were the highest population seen. That being said, you can also see that we saw a vast majority of all age groups, so there really was a good utilization of all age groups within the clinics in the month of December. And on page 15 for our BMI summary, December 2022, the female highest percent of BMI was in the overweight and obese class 1 categories, and male highest percent of BMI was in the overweight category. And that concludes my report.
Thank you. Any questions? Thank you very much.
Thank you.
Ms. Smith with Gallagher. There she is. And you brought help. Excellent. Thank you.
Good afternoon, members of the committee. My name is Marissa Combs-Smith, and I'm here with Gallagher. Also have one of my colleagues, Wes Dozier, here. Wes has been in front of various groupings of folks throughout the process of selecting a broker, but Wes and I share this responsibility, and I wanted to formally introduce him today to you as a committee. Wes and I have shared several meetings over the course of the last couple of months to really get up to speed on what's going on within the county, look at the data, start really unpacking it. And Wes and Kevin Mattice, who you'll meet probably in February, as well as their whole actuarial team, have been working really hard on some of those things. So wanted to introduce him. Our current plan for county evaluation is really to focus heavily right now on what the data is saying, what it said for 2022 actual expenses, compare that back to what it's saying in terms of what we can plan on for 23 and 24 and all of that. So to kind of break it down for you, the first step was we had to get a data warehouse loaded with all of the data from Cigna. Gallagher actually has a relationship with Cigna that allows us to connect directly into Cigna to pull reports and information, which is really nice. So we've been setting that up. That takes some time. Getting the reporting functions correct and getting them loading correctly has been task number one. That's now at completion. The independent actuarial team at Gallagher really is not relying on Cigna's analysis. We're actually looking at it independently. I'm not an actuary, Wes isn't an actuary, but we have folks on our team who actually are actuaries. So what they're doing is evaluating the plan designs, the cost of those plans, the values of them from 2022, as well as the current plan in 23, and then starting to think about what 24 recommendations might look like, and of course also looking at what that aligns next to the state health plan to compare those. We had a CAP meeting with Cigna, which is really a meeting where we look at what their data reporting is. So they have their teams that are projecting out, looking at claims, put together a very lengthy report. I think it's 50 plus pages, it's a lot. And we unpacked that with that Cigna team, but then again, we're doing an independent review of it. So that occurred. That helps us to understand what in their mind the programs that are available through Cigna are that could help with claims. So that's what that's all about. Then now we're closing out 2022. It's important for your committee to realize that, kind of similar to the MedPoint Clinic's comments, that we're actually seeing some continued trend that's still coming in January from what happened in 2022. So 2022 is not fully closed out, but they're working on it. I think it's really close to just now kind of closing out from 22. We plan to present more clarified numbers about that at the next meeting, so that's not ripe for today. Let's see. Also, it's important to note that Cigna, in the breaking apart of the school system from the government, they did not have some reporting built out that they've had to actually build, and our team has had to kind of help them analyze and structure how those reports ought to look. So that's not something I personally have done. That's a team of people who do that, more specialized, but it's really focused on COBRA numbers, retiree numbers, and then actual populations, and then how those are different on the school side versus the county side. So that was actually a little bit of a breaking apart as well. From a budget comparison and projection planning perspective with risk management, we're looking at your current program and also considering the state health plan. Just like our commitment was to you that we would evaluate that, we are doing that. 2022 final financials, like I said, aren't totally finished, but the goal would be to look back at 22 and say, had we been your broker, what would we have recommended the budget be? Because different brokers apply different analysis, and I know you had a different broker at that time. So we want to look at what we independently think we likely would have projected for 23, but informing that with what actual performance was for a complete calendar year of 22. Then we'll take what we were projecting for 23 and look at actual spend as it starts to unfold, and see kind of where things are shaken up for a recommendation on '24. But having that completed 2022 analysis will be very helpful. One of the components of that evaluation is not just, total actuarial value of the plan, which would include, premium spend and that type of thing, but it's also the member cost share and the coverages, right? And so we will be looking at those relationships as well. For 2023, that projection that we would have maybe thought versus what the original recommendation is, what the difference is, if there is one, once we get to the finishing point of that analysis. And then really looking at what closes out that first quarter so that we can help you make really good decisions for your budget year. We've also worked with, we've had a couple of meetings with the MedPoint folks to understand clinic vitality and utilization on a longer-term basis. That's gone really well. They've been responsive in that. We're evaluating utilization, claims, cost, as well as the marketing plan around that. I have a meeting scheduled for my team and Sonia Stevenson to look at HR and how we might continue to help them with HR integration on the My Benefits channel side, as well as what training support she needs or anything else that she really envisions as being fully supportive of her department, like we talked about in the bid phase. One of those projects, in addition, I think, is just to really listen to what is important for Rutherford County employees from a retention and recruiting standpoint as far as a benefits package, and do we have the right mix? Just really kind of evaluating that freshly. So we'll be working on that. So from those preliminary steps, our next phase will be to come back to you and kind of present a strategic plan for you all that will, in a thought leadership kind of way, put together what we're seeing on a national basis, what we're seeing in a regional basis, and then what we're seeing specific to Rutherford County that you might want to consider for the overall plan. That is all, Mayor. Take questions.
Thank you. Any questions? Yes, Ms. Hickerson, you're recognized.
Thank you. So just mainly for my thing when we're getting back to the budget, so hopefully by the end of this first quarter, so March, we will have an idea of some numbers for projection, because I honestly have to have some hard numbers for my April board meeting. That's the first Monday of the month. I always usually project 8 to 10% because that's kind of a back room, always, and then it's pretty close to what we end up deciding here. But I understood you right to say that by this time, and will that give Ed and Michael time to get the budgets ready of what to go out if we're seeing numbers by then? Okay.
Yeah, that is the intent. I'm sure that there will be things you will ask us for, as a committee, or that risk management may ask us for, or Michael and his team may ask us for after that preliminary, discussion of projections. A couple of limitations on that I want to be really transparent about. I think folks who aren't familiar with the process of evaluating what the state health plan is going to do would probably need to know that they release plan design changes after your budget will already be finished. So what we have to do, and we think the most conservative position, is to plan for no plan design changes in the initial evaluation and benchmark based on 2023's plan design at the state being what the 2024 plan design at the state is, even though we know that historically there would be some modification to this or that. It could potentially be a richer benefit in 2024, or it could be a lesser benefit. We don't have that rose color. We don't get to see that far into the future. But what we can do is conservatively model on the current plan design, what they're already in. So we will do that. And then we will present, in a thought leadership kind of way, what we might do either to match that design or to where the places are that it's richer in design.
Okay, thank you. And mainly also for the question is, y'all are new to the game for Rutherford County, not to what you do. And so I guess I was also asking, basically to give you enough time.
Yeah.
Because of us deciding last year and then how quick you got on board, because there's a whole lot of information and there's a whole lot of things that our self-funded plan covers and don't cover and this and that. So I guess that was also another question. Did I really hear you right at end of first quarter? So that's great. Thank you.
You're welcome. I do want to add one other limitation to that. So we talked about plan design comparison, that limitation, which we have a plan for. The other one is the state's rates are set after your budget year closes as well, like once you've already determined your budget. So what we're going to do is evaluate it based on historical trend on the state plan, so like a 3 to 5 year trend, and apply that as what we compare to. The other thing about that is the state has 3 rate tiers, a 1, 2, and a 3, so we will show you all 3 because we don't know for sure where that would land at the moment if you were to go to the state plan. So we want to show all 3, and we'll benchmark what your spend is against all 3 of those projections using current rates as applied to a 3 to 5 year trend.
Okay, so you will be basing those rates on the state's rate with their buy down by having their little pool of money extra that they put towards the rates. So you will take into account what the state said, we needed 8%, but they only charged the employees 5% because they kicked in 3 over here. So you are privy to those numbers that when you do that, you will be bringing their rate, including the buy down?
Great question. I don't know that our team has really roundtabled that particularity yet, but I think you make a great point. We are privy only to what is public, just like you. So I don't have any specialized knowledge of what's going on behind the curtain at the state. I don't want to give any intimation that we would. We don't. But what we can do is look historically at what has happened and apply those pieces of information to the math, and that's more what we're able to do. Yeah. Do you want to add anything to that?
No, I would just say, the evaluation's a little bit more complex than just comparing a rate to a rate, because y'all are on a self-funded plan, so part of the evaluation is, sure, you're going to set the rates, but then you have to look back and see, did we come in under expected, did we hit our expected, or are we over? So we're going to be looking at all of those factors because it's much more difficult than just saying, here's a rate versus this rate. So we'll dig into it.
Ms. Stevenson, you're recognized. Thank you.
So I'm going to ask for forgiveness before I ask the question because I'm not sure that I've understood this correctly, but I'm a little confused as to why this insurance committee would need rates for the school system when the school board is the one who sets their rates. This body is, am I misunderstanding something?
I was not saying we'll do anything like
For
that
comparison?
for the schools.
Okay,
Yeah,
you're just
no.
doing that, okay.
If the schools need budget planning support, we can certainly offer that as part of our relationship with them. But for what we're talking about right now, projecting forward, that's purely county.
So I was misunderstanding. Mary corrected me. Thank you. Like I said, I asked for forgiveness first.
You're fine. Hey, we're unscrambling eggs, right? I mean, this isn't easy, so we'll have to learn together a little bit.
Any other questions? Thank you, Ms. Combs-Smith. Thank you, Wes. With that, we'll move to other business. Is there any other business? Seeing none, our next meeting is February 23rd, and we stand adjourned. Thank you.